Congratulations. We've got just a couple things that we need to wrap up and then we're going to be out of your hair. So I'm going to leave you with your final postpartum instructions. I am leaving you a sheet with everything on here. So I'm going to give you just a brief rundown of everything that you need to know and then we'll get out of your hair. So first of all, you have worked really hard over the last 9 months to grow this baby and you worked really hard to get your baby here. So your body is depleted. So nutrition and rest are going to be the most important components right now. So your body is going to need about 25% more nutrition and calories than a non-pregnant person. So focus on iron-rich foods, healthy fats, and your carbohydrates. Those are the things that I want you to focus on the most. So greens, bone broth, meats, and oatmeal, sweet potatoes, those are going to be some really, really great options. And then rest. I want you to rest as much as you possibly can for the next 2 weeks. So I have the 3-3-3 rule. 3 days in bed, 3 days on your bed, and 3 days around your bed. So that is my rule. You need to be in your bed for the next 3 days. When I come to do your checkups, I want you to be in your room, in your bed. Okay? Your bleeding is going to be your guide. It's going to let you know when you have been doing too much. For about the first week, it's going to be like a moderate to a heavy period, and then it'll slowly transition to kind of a reddish brown and then to a yellow. If you're doing too much, your bleeding will pick up. It'll go back to being red, or it'll go back to being pink. Your body is going to let you know when you're doing more than your body is ready for. Your uterus is cramping down and trying to contract back down to its pre-pregnant size. So that is going to help control your bleeding. We want it to remain firm and below your belly button. So it should be at or below your belly button. If it feels soft or you can't find it, try to massage the top of your uterus and see if you can get it to contract. If you're not having success with that, then grab your baby, nurse your baby, and see if you can get it to contract. You can take an anti-cramp tincture to help with the after pains. I do recommend that you wait 12 to 24 hours before taking that so that your body continues to cramp down effectively for that first 24 hours. So you can also use 600 milligrams of ibuprofen or 650 milligrams of Tylenol every 6 hours. So you can have 4 doses a day. You do want them to be 6 hours apart, and please take them with food if you choose to take that. You can also use black pepper or marjoram essential oils, and I can give you more directions on that if that is a route that you would like to choose. Your perineum, the tissues between your vagina and your bum, are going to be a little bit swollen and they're going to be tender. There may be a little bit of sensitivity and bruising, especially if you tore. So that is normal. There may be some stinging with urination, so we have left you a peri bottle. Fill it with warm water, and you can use that to dilute your urine, and you can also use it to spray yourself clean, and then pat dry. When you get ready for your first bowel movement, you can support your perineum. Again, that's the tissues between your vagina and your bum, and that can kind of help give some relief with the pressure of that first bowel movement. But you also want to make sure that you're getting in lots of fiber, and you can use a digestive enzyme or stool softener to help with that first bowel movement as well, to keep them soft as if you're feeling tender or if you are worried about it. Your breasts are going to go through a lot of changes over the next few days. You may notice that around day 3, your breasts will be a little bit fuller and a little bit more painful. Your mature milk is going to be developing. If you feel like your breasts are overly full, you can hand express or pump, but only pump until the discomfort has been relieved. You don't want to empty the breast. That'll stimulate more milk production. It is normal to experience a little bit of tenderness when you are learning to feed a new baby, but it should not be painful. If you are experiencing pain when you are nursing your baby, there is something wrong. Unlatch your baby and try again. If you continue to have pain, I want you to contact me or to get a hold of a lactation consultant. I will give you a referral on your page so that you can reach out. And then your baby is going to want to be skin to skin with you as much as possible over the next 16 hours. This is going to help stabilize their temperature, their breathing, their heart rate, their metabolism. So keep your baby close to you as much as you can for the next 16 to 24 hours. Your baby's breathing is going to be a little bit irregular. And this is totally normal. Normal respirations are usually between 30 and 40 beats, anywhere up to 60 breaths per minute. Counting their respirations is best when they are completely relaxed and lying on their back so that you can see their belly rise and fall. If you notice any straining in their neck or chest, or grunting or flaring of the nose when they're breathing, this is a bad sign. And if you think that there is something wrong, call 911 and get some help. These are not good signs. You don't want to see blue tinged lips or straining in the nose, throat, or chest. Your baby's temperature should be between 97.7 and 99.5. Keep your baby warm and dry, and dress them to one level above your comfort level. So if you're feeling pretty good in shorts and a t-shirt, then your baby needs to be in at least long sleeves and long pants. Wrap them up in a blanket. Keep your baby warm. Cord care. Keep the cord clean and dry as well. There's no need for your baby to have a bath for the first week. The vernix is on their skin, and it's going to help with their immune system. It's going to help with protecting them, and they're not dirty when they're born. If you notice that there are blood spots in their hair, you can just sponge bathe their head. They don't need a full bath. So just keep the baby's cord clean and dry, and fold the diaper or get diapers with the little umbilical notch so that their cord is exposed to the air and not inside the diaper. It is normal for there to be a slight odor and blood or discharge in the around the cord, but if it becomes inflamed or pussy